So hi everyone, and welcome to another episode of Best Practice in Conversation. And today I am delighted to welcome Jennifer Neff to have a chat with me. Jennifer is the CEO of Elemental, a platform for social prescribing, something that I am really interested in, and obviously something that would be of huge interest to primary care and the GPs that I work with. So Jennifer, thank you so much for joining me today. I'll let you give a little intro on yourself and Elemental, and we'll take it from there. And actually I have to mention as well, just by surprise, that today is National Social Prescribing Day. Or is it international, Jennifer? Maybe it's
international now, actually. I think it started off as national, but now it's international.
Yeah, which is really cool. So I'll let you introduce yourself a little bit more, and thanks for joining me today.
Thank you. And thanks so much for asking me to speak with you today. Yeah, it's really, really exciting. We are Elemental, and Leanne Monk and I founded Elemental. We were community development workers working in some of the most socially deprived and disadvantaged communities. And what we wanted to do was better connect people and to their communities more, so that we could connect the community, connect them into things like walking clubs and men's sheds and gardening clubs and volunteering opportunities and maybe weight loss support groups or debt advice. Because everyone knows that when someone's connected into their community, when they're engaging in services and programs and activities that are good for their health and well-being, they're going to be healthier and happier. So Leanne and I wanted to really kind of build on this, because we could see, being community development workers, we could see the difference it was making to people's lives, but we also could see the challenges that were associated with that. Sometimes there's often silo working, or there's a disconnect maybe between health and housing and community and maybe in local councils. So we wanted to try and better connect everything up together. So we created Elemental, and it's a digital platform that's used by GPs and social workers and OTs and community pharmacists to make referrals for people to what's known as social prescribing link workers. They're like community navigators, well-being teams, people who understand the different things that are happening in the community, and they're able to help people understand what's available, help them to access the services. Sometimes they even go along with them to services and really tackle some of the social determinants of health and the challenges that people are facing.
And that's very significant, really, because I suppose from my own background, I worked for over 17 years in management and general practice myself before setting up Best Practice. And I suppose one of the things that I would have seen quite a lot of would be repeat visits. So people coming into the practice all the time. And often it was just, there was a social perspective there as well, that they didn't need to be attending all the time, where perhaps social prescribing, had it been available, not that it wasn't available, because there were groups out there, but it's connecting the patient with those groups and with those services. So how does Elemental, because I know it's obviously fairly well established in the UK, Northern Ireland now, Jennifer. So tell me how it would work from a GP perspective. So somebody comes in to them and the GP feels that actually they would benefit hugely from connecting to various different services that are out there. How does that work?
Yeah, and just to build on what you said as well, that the research has shown that over 20% of patients that appear with GPs, actually it is social issues that they're facing, and it's not medical. So yeah, what's happening, we're actually being used in parts of in Dublin, in South Dublin County Partnership, Bray Partnership, and then the South Dublin Partnership as well. And the way that it works is that a GP or maybe even a practice manager would be able to organise for a referral to be made for a patient. So if someone goes to see a GP and they might be maybe anxious or depressed or something like that, and the GP, yes, or lonely, the GP might suggest to them to say, look, we have one of our team is a social prescribing link worker, and they are going to be able to help you, tackle whatever the issue is, it a housing issue or a debt issue, or just you want to get out and about and meet people, and they would use Elemental to create a referral. So it's a little simple referral form. It just puts their contact details, the reason for a referral, and then if there's any additional access needs or maybe some safeguarding needs as well, for the social prescribing link workers, that referral goes straight over then electronically, really safely and securely over to the link worker, who would get a notification to say, log into Elemental, you've just received a referral. They can view the details about the person. They've all the information there. They can phone the person up, have a chat with them and arrange an appointment. And then when they're meeting up with them, they can find out what matters to this person. What does this person really like to do? Rather than focusing all the time on the negative, it really turns the conversation around to say, well, look, what would help you? And it's really person-led. So then they would maybe do a little baseline analysis just to see if it was anxiety or whatever. They would ask them a few questions. There's a number of built-in measurement tools just to find out on day one, how's that person feeling? And it's great because you can show over the matter of 3 or 6 months then that person's anxiety levels dropping as a result, or their well-being is increasing. Then that person would say, well, look, I only want to do something within a mile radius of where I live. I want to do maybe something that's a bit of light exercise, something that's free, and something that's for beginners. So within Elemental, there's a big live and interactive database of services. The link workers, they populate that, and it grows over time. And they're able to say, well, look, based on what you were talking about today, there's a walking group that meets up at 10 o'clock on a Monday, and they meet at this particular shop. And then the person would say, well, look, yeah, that looks interesting. I'd be interested in that. And then there's another little referral that would be sent over to the person who coordinates the walking group, or maybe the person who coordinates the art class or the gardening. And they would get a notification then to say that the following people are interested in taking part in your services.
So they could contact them independently then as well, or would it always be the link worker who'd be coordinating all these different things?
Well, they can contact them. They can then engage in the service. The link worker might decide that they will meet up with the person again, maybe as part of the program. It's every 6 weeks. So when the person comes back and they would say, well, how did you get on with that? And did you enjoy it? And if the person did enjoy it, they're able to kind of rate that service too. So whenever the link worker's talking to someone else, they can say, well, look, other people who've gone to this have rated this 4 out of 5. It becomes like a little, just a little sort of way of letting people know kind of what's out there. So, but
can I ask you, just from when we're talking back again to the 20%, so if 20% of patients attending are more appropriate, say, for social prescribing than anything else, okay, and so from their perspective, it's not going to cost anything. So, but in the first instance, when they attend their GP, so let's just say it's somebody who has a medical card, they come in, the GP, or you say the practice manager, but if it were the practice manager, then it wouldn't be an appointment with the GP, it should be an appointment with the practice manager, I would imagine, who would then, and it might have been, you know, that the GP would have said to them, this person is more appropriate for social prescribing, so can you liaise with the link worker and get them set up? Is that how it would work?
That's it, exactly.
Okay.
And as it's growing now over time, you are starting to see social workers as well in hospitals. So I know that there's a social worker in Tala Hospital that's making referrals for patients when they're being discharged from hospital straight through to Deirdre, the social prescribing link worker, who is then able to follow up with the patient and engage them, and maybe if it's housing support that they need, or if it's maybe some other social kind of support.
And can I ask you then, for each region of the country, would there be separate link workers that would be linking in with all the various services? Is that the plan, that all the different localities would have a link worker?
That's it, yes. So there's, at the moment, there's 20 plus social prescribing projects that are happening all over Ireland. And a lot of them may be based in the community and voluntary sector. But what we've seen now in England and Scotland, the NHS is funding more and more link workers there, so that there can be a social prescribing program and link workers everywhere. That's the view in England and Scotland and Wales.
And how about in Ireland? Where are we with it now? Because presumably you're looking at the HSE model and whether or not it could be potential funding there. Is that looking?
Yeah. So it's a lot of funding now has already been directed towards social prescribing, and I think there's great work happening in the HSE. There is a framework for social prescribing. It's written into all the major kind of strategies. It straddles a lot of the kind of themes within health and well-being, which is good. It just doesn't sit in isolation, because it can be across everything: children, young people, long-term conditions, you know, anything. So there's a framework for that. I think that's been launched now. There's talk of that being launched in May. And there was an evaluability assessment done as well of it, because a lot of people say, well, look, what's the difference that social prescribing is making? So there was an evaluability assessment done to be able to say, look, when we are commissioning social prescribing, let's look at what the changes that we're expecting to see. because sometimes in England, what they were doing, they were asking the community and voluntary sector to talk about the reduction in GP appointments, the reduction in A&E attendance. But more often, community and voluntary sector organisations don't have access to that type of data. So I think what was really forward thinking of the HSE to say, look, let's see what's within their gift. They can talk about how many referrals, they can talk about the types of referrals and the reasons for referrals. They can talk about the types of activities that people are engaging in. They can also talk about, has there been an increase in well-being, a reduction in depression or anxiety levels? That's all within the gift of the community and voluntary sector. They've been doing great case studies for years in terms of the difference it's made to someone's life.
And what sort of, like, could you summarize some of the data from that?
Yeah, definitely. What we've seen is that the main reasons for referral that we've seen from those people that have been using Elemental has been, and it's no surprise, it's mental health, the impact of COVID and social isolation and loneliness.
So huge at the moment and into the future as well, isn't it? It's going to be
definitely. And what they've also found is that the things that people have needed most is access to befriending, to food banks, and to social welfare, legal advice and debt advice. So they're the main types of services. So when you're using a system that collects data like that along the journey, you're able to see where the gaps are. You're able to see where there's maybe not a provision of something, that there should be something there in a particular community that maybe is suffering from the likes of suicide, bereavement, or maybe, you know, high levels of anxiety or whatever. You need then to be able to look and say, well, do we have enough services here and things for these people to engage in to help reduce their health risks?
And it's so important, you know, ultimately everything should be driven by data. So it's so useful to make sure that we are on top of that and making sure we're putting the services where they're needed. And ultimately, it's cost saving at the end of the day if we're doing it in a strategic, data-driven way.
Exactly. And the big challenge is making sure that the technology doesn't take over, but it's there in the background. We always say people first, technology second.
Yeah, and that's what I love. You know, I love that idea that obviously you have the digital platform from the GP perspective, and that's part of the pathway for the patient to access whatever care or supports that they might need. But ultimately, the patient has a link worker, so the person that they're dealing with, and that's hugely important. So going back to the GP again, so how does the GP access it? How does the GP sign up for it? And do you already have some GPs in Ireland who are using it?
Yes, yeah. So there's a number of GP practices that are using it, and they will complete the referral form, and it'll get sent over then with the details to the social prescribing link worker. What we do in England, and more so recently in Scotland and in Wales, is we connect in with the GP systems, so that a GP doesn't even have to leave their clinical system. And if they think a patient would benefit from social prescribing, within 3 clicks, a referral can be sent and generated within the GP's clinical system.
So are you working with, for example, Clanwilliam Healthcare at the moment? Because they would probably be the main provider.
Yes, I've been chatting to them, and we've had a really good discussion around it. And so we're looking at seeing kind of where that goes next. And then there's the likes of health links and things. So we're going to be getting to chat to them. It's about making it as easy and simple as possible, because obviously the GPs are up against their time pressure. So they don't want to have another system to log into and log out of their own, for example. So, and we've what research has shown us, and the data coming from our own platform, there's nearly 10,000 GPs now using Elemental for social prescribing. So it's showing that when that happens, and when it is easy and simple, that GPs will then look at it as maybe not always an alternative, but as a complementary way to support their patients and help them really address the social issues that they're facing.
Yeah, I think it can be a combination of alternative and complementary. You know, it's not going to be the other, really. And Jennifer, how do GPs contact you if they want to find out more, or is it a matter of logging onto your website to check it out, or to arrange demos, or how does that work?
Yeah, you can log on to the website, elementalsoftware.co, and you can organise a demo. There's lots of even chatting to their local social prescribing link workers as well. So find out, is there a social prescribing link worker service available in your community?
How will they know that, or how will they find out?
I'm just thinking that there's a new there's a social prescribing network Ireland. It's an all Ireland network, and their website's coming soon with all, and it'll have a little map actually of all the different social prescription programs. But I'm sure maybe even if you contacted Orla Walsh at the HSE, she would be able to send she'd be able to send some information across as well. But I'm also thinking, yeah, on there's the Twitter handle at Ireland_social is the new Twitter handle. If people wanted to go on there, there'll be a little map put up there. But there'll be lots of things happening, and social prescribing link workers is going to just be more and more of that coming. So it'll be great to be able to connect up health and community even more than it's already been connected together already.
It sounds really exciting, and obviously there are some elements of it that are still a work in progress. But in terms of Ireland, I mean, in the Republic of Ireland, and getting those connections in with the Socrates or Health One or the Helix Practice Manager, whichever one the GP is using, it's something that I've always been, very passionate about. I think it's so important from the patient perspective to be able to have a more streamlined approach, I suppose, to accessing all these different types of services. Jennifer, it's been really lovely speaking with you today. What I'd like to do, though, perhaps, is if you supply me with some of those links that you mentioned, even from in terms of accessing information in that, and what I'll do is I'll put them up when we put out this interview, and they'll be useful then for the GP just to do a little bit more research or whatever, and all your contact details.
We could even
there too.
Put up a little case study as well there. Maybe there's South Dublin County Partnership, even we're helping people to learn how to access Zoom, and on a Friday the GP would join their Zoom class, and it was just great for people to meet the GP and for just to chat and kind of put their mind at ease. So there's lots of good case studies out there too.
Brilliant. That would be really, really great. Jennifer, thank you so much for taking the time today. I really enjoyed the chat with you.
Thank you.
Very short and sweet. And again, happy International Social Prescribing Day.
Yes, exactly.